When we talk about sinus lifts, we're generally talking about teeth in the upper jaw and the posterior aspect, usually the posterior molars. And we all have sinus cavities. They're up in the cheeks. They're big hollow areas. A lot of people will notice it when you have sinus congestion, cough, colds, and things and such like that. Well, a lot of people's sinus cavities are a lot bigger anatomical wise than some. And the problem becomes that when you remove the posterior teeth of the upper jaw, in the back especially, that sinus cavity, if it's large enough, can leave you with very little bone for implant support. So basically the bone that you'll have for placement of an implant is what is left remaining where the teeth were at between the sinus and the mouth. And my best analogy is, I tell a lot of patients, I grew up on a farm. If you put a fence post a foot into the ground, it's not going to last, it's not going to work. You need the fence post several feet into the ground. So there are times that we have to come back and add bone to the back jaw, and the way we do that is actually by using the hollow sinus cavity up above where the teeth would be at. And we typically have to remove a little bit of bone on the sides. We make a little window to go into the sinus cavity, and at that point we're able to lift the sinus membrane out of the way, place bone in here, and that will, over time, as it matures and hardens and condenses, it will turn 3 millimeters of bone into potentially 13 millimeters of bone. That way you can get that longer fence post into the ground to allow better stability and long-term longevity of that implant.